So here we have data on oratorio PPMS patients where we look at an endpoint called 9-hole peg test, which is a measure of upper extremity function. And there we show that in both patients that are earlier as well as later in their disease course benefit from Ocrevus. And that was important because that informed our next trial we're planning called ORATORIO-HAND. And in that trial, the primary endpoint is 9-hole peg test or upper extremity function in PPMS patients. In PPMS patients, the preservation of upper extremity function is very important, especially as patients advance. They become wheelchair bound, and so maintaining the arm function is very important. So that's why we wanted to examine this in this ORATORIO-HAND trial, where we'll look at patients that are more advanced, higher disability, and older patients as well. So we're designing the trial now. In fact, we just had a steering committee meeting here at ECTRIMS, and the trial is set to begin in the first half of next year. And it'll be approximately 1,000 patients, and it'll be Ocrevus versus placebo in primary progressive MS patients. These patients will be more advanced. We're going to allow more advanced patients than we did in our original trial. So EDSS of 3 to 8, so a higher EDSS point, as well as older patients. So we're going to allow patients that are up to age 65 into the trial. And the countries we're selecting now, we should have a final selection fairly soon. We want people to focus on the fact that this is the first trial where the primary endpoint will be upper extremity function, 9-hole peg test. And PPMS patients are progressing, and as they progress, the upper extremity function becomes more and more important for these patients. So we are showing, or we want to show, that we can have an effect in preserving the upper extremity function in these patients. So that's really the main reason we're doing this study, so look for that, and it shows our commitment to progressive MS patients, PPMS patients, to really understand the disease and to really make better outcomes for patients with PPMS.